Good afternoon, friends, and welcome to today's Guide to Medicare and Golden Retirement event presented by Medical Mutual. Navigating the complexities of Medicare can be a daunting task, but fear not. Our expert speakers are joining us here today with one unified mission: to simplify and demystify the process. So whether you're a seasoned Medicare beneficiary or someone just starting to explore your options, our experts are equipped to break down the information into manageable and understandable pieces. And we know many of you have questions about Medicare, and we want to hear them, so do not hesitate putting them either in the chat or in the question and answer box. And when you do that, make sure you pick all attendees and participants. Otherwise, it will come right to me. If it just comes to me, no worries. I will get it to our team, because our team is ready to respond, whether through the direct chat replies or during that dedicated Q&A segment on the virtual stage. So all of your questions in the corresponding answers will then be compiled and sent to everybody in attendance via email at the beginning of next week. This comprehensive document will include not only the Q&A, but other valuable resources provided by our experts. Now, before we delve into today's program, we want to thank our sponsors, without whom this event would not be possible. A big thanks to Medical Mutual, the Ohio Department of Insurance, and Apex Skin, who have a segment at the end of this program which you will not want to miss. For more information about these fantastic partners, make sure you check the chat or visit the event website. So let's get this show on the road. Here's what you can expect today. Sarah Florimonte from the Ohio Department of Insurance will kick things off with a comprehensive overview of the various Medicare options. So get ready to gain a solid understanding of the total landscape. Following the overview, our experts will dive into a detailed discussion on the crucial topic, how to choose the right plan for your needs. Then after that, we move into what to consider when choosing a drug plan. And this segment will equip you with the knowledge needed to make informed decisions about your drug coverage. And finally, a segment on one of the most overlooked aspects on Medicare, your skin. Our friends from Apex Skin will be here to provide insights from the provider's perspective and share essential tips on how to protect your skin as you age, ensuring that you can relish the golden years to the fullest and have the coverage you need to stay safe. Now, guiding us through these important conversations is Julie Washington. As a healthcare reporter at Cleveland.com and The Plain Dealer, Julie is renowned for covering major news stories and offering insightful commentary. All right, let's get this first thing going. It is my privilege to introduce our first speaker for today's session. Please join me in welcoming Sarah Florimonte. She is the community liaison for the Ohio Senior Health Insurance Information Program, OSHIP, to the virtual stage. As part of the Speakers Bureau, Sarah goes out into the community and provides education to the public through speaking events like this, counseling, and other public-facing opportunities. Sarah is also responsible for being a touchstone with the volunteers of OSHIP, providing them with support, resources, and the tools to help them better serve their Medicare clients. Sarah, first, welcome, and second, the stage is yours.
Thank you so much, Eric. I appreciate that introduction. My name is Sarah Florimonte, and I do work for OSHIP, which is the Ohio Senior Health Insurance Information Program. We are a touchstone for Medicare beneficiaries, and those who serve Medicare beneficiaries are those who help people with their Medicare here in Ohio. We're able to offer objective, unbiased information when it comes to Medicare. In addition to the Speakers Bureau, like I'm a part of, like Eric mentioned, we also have a toll-free helpline that's open 7:30 to 5, Monday through Friday. It's local in Columbus, Ohio. So when you call that hotline, you're going to get someone in Columbus that's going to be able to answer Medicare questions for you, again, in that unbiased, objective way. That phone number is 1-800-686-1578. So please use OSHIP as that touchstone. We also have a network of volunteers throughout the state that are able to meet with people one-on-one. So if you're starting Medicare for the first time and you need that one-on-one individual experience, or if you've been on Medicare for a long time and you need to do a checkup or something like that, those volunteers are available for you as well. You can call our hotline, again, 1-800-686-1578. Give them your zip code and they'll get you in touch with a local volunteer in your community. So that's a little bit about OSHIP. Let's dig into Medicare. Like Eric mentioned, I'm going to try to do a little bit of a comprehensive overlook here, but 10 minutes is a short amount of time to really dig in. So I hope that I'm able to alleviate some of your questions about the different options when it comes to Medicare. So we talk about different options when it comes to Medicare. Inside these options, there's even more options, but this is an overview. When you're starting Medicare and as you're going on through your Medicare journey, you have one big decision to make as how you receive your Medicare. We call this list option 1 or option 2 in our chart here. Option 1 is sometimes referred to as original Medicare. So you see that red, white, and blue Medicare card? That's your original Medicare card. It has your name, your Medicare number, and when you started Medicare. With option 1, your Medicare is going to be your primary insurance. So they're going to cover about 80%, very simplistically, of your needs, your medical. With option 1, you also are going to have or purchase secondary insurance that's going to come in and it's going to pay what original Medicare did not. Most people, their secondary insurance is going to be something called a Medigap or Medicare Supplemental Insurance Plan. And again, that's going to come in and pay what original Medicare does not. You could also have group health insurance from a former employer or union, or if you have Medicaid, Medicaid's going to act as a secondary insurer. So with option 1, there's a couple different ways to have that secondary insurance, but most people, it's going to be that Medigap or Medicare Supplemental Insurance Plan. And then with option 1, you also have a separate prescription drug plan. So I like to think about these as cards in your wallet. So with option 1, I have 3 cards in my wallet. I have an original Medicare card, which I'm paying a premium for. I have my secondary insurance. If it's a Medigap or Medicare supplemental plan, that's going to be an additional premium as well. And I have my prescription drug plan. So I have 3 separate things that I have that I'm paying for that encompass all of my needs. So that's option 1. The other option is called a Medicare Advantage plan. When this first came out, it was often referred to as Part C. So if you hear the term Part C or Medicare Advantage plan, those are the same thing. And that is one comprehensive plan that encompasses everything from a private insurance company. So that's a managed care plan that acts as a replacement to original Medicare. So you have one card in your wallet from that private insurance company that encompasses everything. Most of these plans also include the Part D, so you don't have to go get a separate Part D plan. And they also have some extra benefits that original Medicare might not have. So when you're first starting Medicare, again, this is the big decision you have to make. Am I going to go with option 1 or am I going to go with option 2, a Medicare Advantage plan? So those are my options. Just real quick, a couple pros and cons to both options. I always tell people there's no right answer. We're here to give you the information and then you decide what's going to work best for you. With option 1, you can go to any doctor or provider that you want. So you don't have any network whatsoever. With option 2, you are going to have that network of doctors and providers. Option 1 is more costly monthly because you are paying a premium to be on Medicare and you're paying a premium for that Medicare supplemental insurance. So it's more expensive every month, but it's much more comprehensive because once you pay those 2 premiums, you're going to have little to no out-of-pocket costs. So you're paying more monthly, but then when you use your insurance, you're spending less out of pocket. With option 2, you're still going to pay your Part B premium. Everyone on Medicare pays that Part B premium. Most Medicare Advantage plans have no additional premium, so you're not paying a monthly premium, but then when you go to use your insurance, you're paying out of pocket costs. You're paying co-pays and co-insurance out of pocket. So as you can see, these 2 options do function very differently. And again, when you're starting Medicare for the first time, this is the most important decision you're going to make. It's important to note that with option 1, if you're purchasing a Medigap or a Medicare supplemental plan, you may not be able to purchase a Medigap plan later on. Medigaps have something called a guaranteed issue period. And what that means is when you start your Part B, you only have 6 months to purchase a supplement with no medical questions being asked. And that's again with option 1 with that secondary insurance. So if you don't opt into the option 1 when you're first starting, you may not be able to get it later on down the line. I'm not trying to scare anybody or anything like that, but if you are first starting Medicare for the first time, it's really important that you understand what the differences are between these 2 options and how the decisions you make in the beginning when you're first starting can affect your options later on. Again, that is a very, very brief overview of the different options. I would really encourage you to come to one of our webinars that we offer or give us a call, meet with one of our volunteers in the community. Again, at OSHIP, we are that objective, unbiased information when it comes to Medicare. When you're starting off on Medicare, you're going to get a lot of advertisements in the mail. You're going to see a lot of marketing on TV. You're going to be inundated with information that comes into you, especially during this open enrollment period. We're in the middle of open enrollment. No matter what option you have, you do have to take advantage of that open enrollment period. If you have option one, your prescription drug coverage, that's something you're going to want to look at every single year during open enrollment. We're in the middle of it now, October 15th to December 7th. Looking at your prescription drug plan every year, you want to get in that habit. We save people thousands of dollars at OSHIP comparing their drug plans and making sure that they have the best drug plan available for them. If you have a Medicare Advantage plan, that also has an open enrollment period, and you're able to look at your Medicare Advantage plan every single year during open enrollment to make sure that you have the best Advantage plan available for you. So use us as a resource at OSHIP to make sure you're getting that objective, unbiased information. So that was, again, a very broad overview, and I look forward to answering some of your questions during our panel. Back to you, Eric.
Thank you, Sarah. And the cards in your wallet might be my favorite thing ever. Okay, the information that Sarah just showed you is available on our resource page. The link to the page is in the chat, and we'll also send it to you via email after today's event. Let's dive a little bit deeper and discuss how you can choose the right plan for your needs and what coverage you should have. For that conversation, we will welcome Sarah Floramonte back to the stage, and we'll also welcome Amanda McFarland and Dr. Dave Muzzina from Medical Mutual. Amanda is the account manager for Northeast Ohio, supporting the Medicare and individual markets. Amanda has been with Medical Mutual for more than 7 years and has more than 20 years of experience in the Medicare industry. Dr. Dave Muzzina is the VP and Senior Medical Officer for Medical Mutual. He has led the development of the company's advanced clinical infrastructure and operations, has recently assembled an additional strategic responsibilities for internal clinical operations and support of cross-functional partners throughout the organization in order to promote the delivery of high-quality, customer-responsive, and cost-effective Medicare. He's been with Medical Mutual since 2015. And let's bring in our moderator for all of this, Julie Washington, and let's get it going. Julie, the stage is yours.
Thanks, Eric, and I'm so glad to be here. Once again, I'm Julie Washington from The Plain Dealer. I'm a health reporter there. I've been a health reporter for about 4 or 5 years, and this is my second year being part of this webinar, and I'm so glad to be here. And it has special significance this year because my husband is turning 65 next week. And so he has been inundated with all the information, as you said, and all the phone calls and mailers, but I think he's found the best plan for him. So I told him that he goes first and then he can explain it all to me in a few years when I turn 65. But let's get started with some questions that I know that our audience will have, and hopefully we'll get you some answers, and then you can also put additional questions to us, and we'll get to those also. So let's start with Sarah. When does the enrollment period start and end?
The annual enrollment period for people already on Medicare is from October 15th to December 7th. If you're just starting Medicare, however, you don't have to worry about the annual enrollment period. There's also general enrollment period when you're just starting, as well as an initial enrollment period. So what we're doing right now, we're in the middle of what's called the annual enrollment period from October 15th to December 7th.
All right, so right there, it gets a little complicated. All right. Are there different, you explained before about the different Medicare plans. Do they each have a different enrollment period?
No. So the annual enrollment period for October 15th to December 7th is for Part D prescription drug plans. So if you think about that chart I showed earlier, that individual Part D plan, that's the annual open enrollment period that we're in. And then also for Medicare Advantage plans, at October 15th to December 7th, you have the ability to change your Medicare Advantage plan. There's also a Medicare Advantage open enrollment at the beginning of the year. So if you're in a Medicare Advantage plan at the beginning of the year and you want to change your plan, you can do that from January 1st to March 31st. I would say those are the most common enrollment periods that we see.
Okay, great. Good to know. And Amanda, who needs to enroll or re-enroll? Does everyone need to do that, or just certain people?
Yeah, so I think this time of year is a great time for everybody to look at their plan and make sure that they are in the plan that best fits their needs. Your needs change from year to year. You know, maybe last year you had a surgery and this year you need dental coverage. So making sure that your plan didn't lose any providers, your prescriptions are still covered. Everybody should be looking at their plan, even if they don't make a change.
Okay, and it's really about what fits you.
Correct.
Yeah, because obviously I would need eye insurance
Yeah,
and other things. So it's what fits your lifestyle
absolutely.
and the medical conditions that you have that you're looking at.
Yeah, you might not be on the same plan as your husband.
Right, right. Now, let's say someone is turning 65 in 2024. Do they have to sign up for Medicare during that enrollment period? And what happens if they miss that window? Amanda, would you like to take that first?
Yeah, absolutely. So if you're turning 65, it really depends on your situation. If you're still actively employed, and depending on the group size, you might be able to defer your Part B enrollment. Typically, members enroll in Part A because it's premium free. There's no cost to Part A. So generally, most people will enroll in Plan A. But for Plan B, if you're on a group of over 20, that group plan is primary. So there wouldn't be any financial benefit to enrolling in Part B. Now, if you are retiring and living that life, then you would definitely want to enroll in both parts so that you don't later on have a late enrollment penalty. So it varies from situation to situation.
Sarah, do you have anything to add?
Yeah, the only thing I would add to what Amanda was saying was that this enrollment period from October 15th to December 7th is for current Medicare beneficiaries. So if you're turning 65 in January or February, you don't need to worry about this enrollment period. This enrollment period is not for you. You'll be able to enroll and start everything that you need to start when you are eligible. So that eligibility, if you're turning 65 and you want to enroll into Medicare, Medicare always starts on the first of the month. So if you're turning 65 February 1st or February 15th, your Medicare is going to start February 1st. And this enrollment period, you don't have to worry about that. You're going to have your own initial enrollment period, and you can start doing that 3 months before your 65th birthday. So the open enrollment period that we're in right now doesn't apply for people who will be starting Medicare in 2024. They'll have their own initial enrollment period that they'll be able to take advantage of.
Okay, great. Good to know. Dr. Musina, what is the difference between Medicare and Medicare Advantage? Can you explain that, please?
I'll try. You said this was going to be complicated. And so, yeah, thinking about original Medicare, which is provided by the federal government for seniors over the age of 65, there's primarily two parts to that. There's Part A, which is your hospital insurance coverage, and Part B, which is your medical insurance, things like outpatient doctor visits, services, and labs. And those are the two major components of original Medicare. And when you get to Medicare Advantage, you have an all-in-one plan that combines Part A and Part B from original Medicare, and then typically layers in prescription drug coverage, which is Part D, and folds all of that together in an all-in-one plan. And typically what you'll see in the difference is the co-insurance, the co-payments can be lower for the Medicare Advantage plan. And many Medicare Advantage plans have a $0 premium for the beneficiaries. And you'll have additional perks like the dental, hearing, vision, and it may vary between plans. So it's important to look at that along the way as you're making your decision.
Okay, but we should point out too that Medicare Advantage is private insurance, correct? It's not from the government.
Yeah, it's a tough question. So the question of, is Medicare Advantage a government-run program? Medicare Advantage is administered by private insurance companies that have filed with Medicare and are regulated by Medicare, heavily monitored by Medicare, and so there is that distinction.
Okay, great. Good to know. Is it possible to receive both Medicare and Medicaid?
Yeah, that's a great question. We get that question a lot. What are the differences between Medicare and Medicaid, and how do they work together? So most people know Medicare is an age-based program. So when you turn 65, you're going to be eligible for Medicare. Medicaid is based on your income and resource. So you have to qualify for Medicaid based on your income and resource, and they definitely work together. If you are eligible for both Medicare and Medicaid, your Medicare will be your primary insurance, and then your Medicaid will be your secondary insurance. So that's pretty much in the back end, though. You really don't have to be overly concerned about how they work together, just knowing that you can have both Medicare's primary, Medicaid secondary. There's also Medicare Advantage plans that are formulated for people who are dual eligible, is what we call them. And those might be great for people who do have Medicare and Medicaid. So if that's your situation, you also have a lot of options for how you receive your Medicare and your Medicaid.
Okay, lots of options out there
Yep,
that everyone has
absolutely.
to sift through. Okay, all right. Well, as I mentioned before, my husband's getting on Medicare. He's also on my insurance plan for my employer. Can he be on both at the same time?
Yeah, absolutely. So with Original Medicare will coordinate benefits with a group plan. As I mentioned earlier, whether or not you should enroll in Part B, the part that you have to pay for, really depends on your group size. You wouldn't want to do group in like a Medigap plan, like Sarah mentioned before, because you're not really going to get any benefit from it. But yeah, if you just had Original Medicare and you wanted to be on your spouse's plan, that would not be an issue at all.
Okay, great. Dr. Musina, did you want to add something?
Yeah, not on this particular topic, but as we're moving ahead and talking about choosing the right plan, I mentioned the difference between Medicare and Medicare Advantage. Thinking about does it cover prescription drug? Does it cover the hearing, dental, and vision? And I referenced other perks, and so the thing to also consider, are there things like transportation, food, over-the-counter supplies that you're able to obtain through that plan as you're comparing and making your choice. Are there other things I forgot there, Amanda, when you're looking at those additional perks and the differences?
Yeah, absolutely. So I think like if I'm a consumer, if I'm sitting down with my grandma and I'm talking about, kind of what you would be asking, I think that there's probably a handful of things that are going to be most important to members. First is their doctors, making sure that their doctors are in network. Every carrier is going to have a different network, and prescriptions. Those are the two things that a member is going to use. They're going to get their prescriptions filled and they're going to get their doctor. So once you know what plans cover those two things, then you move on to the benefits of the plan. And I think the benefits that you would want to pay most attention to, in my opinion, would be max out of pocket. What is my max exposure on a plan? So max out of pocket, if you're not familiar with that term, is the most that you would pay for Medicare A and B services. So you want to look at that. You want to look at what are you going to be paying when you go to the doctors. There are plans out there that have no cost copays for going to a primary care and a specialist. So that's important. And then looking at the extras, like you said, so dental, vision, hearing, over the counter, things like that. Everything's going to be different. So those are the benefits that I would hone in on the most. And again, each person is going to be different as to which one's important to them.
Yeah, I think Amanda really hit it on the head with that order. When we think about Medicare Advantage plans, thinking about the very first thing is that network and the prescriptions, and then thinking about the extra benefits as extra benefits and making sure that you have the right plan for your medical and prescriptions, because that's what Medicare is supposed to be for. So putting those extra benefits last on that list, I do love that order that Amanda talked about.
Yeah, absolutely. I think sometimes you can get so caught up in those extras that you purchase it for them and forget that those plans are really there for your medical, and those are just extra benefits. So you want to make sure that you protect yourself on the medical side, and then those are just enhancements.
Right.
Dr. Musinga?
Yeah, I agree. I mean, remembering that when you're making those selections, if you like your current provider and where you're going for your care, those have to be top of mind so that you don't run into a surprise after you've done something with your choice.
Yeah, it's so important to make sure if you like your doctor, you want to make sure that that person's still in your network.
Absolutely.
Correct.
Right, right. When you're shopping for Medicare Advantage, how can you be sure that you're getting the most affordable option?
Yeah. So, Sarah mentioned before, there are a lot of zero premium plans in the market. And honestly, majority of members enroll in the zero premium plan. So I think from a premium affordability, that generally is not an issue. Again, it's looking more at those benefits. If you have 4 specialists and one carrier has a $50 copay versus another one that has a 0 copay, you could be looking at spending $200 a month in copays versus zero. So really diving into the benefits that you're going to use.
The prescription drug benefits, especially.
For sure.
Whenever we're sitting down with someone at OSHIP, that's the first thing we ask. Do you have a list of your drugs? Because that's usually where we're really able to save people money, is making sure that they're on, regardless of what option they have. If it's Medicare Advantage, they're on the best Medicare Advantage for their prescription coverage, or if they're on option 1 with that separate Part D coverage. So looking at your prescription drug coverage, regardless of what option you're on. It's also important to know that companies have lots of Medicare Advantage plans. So you might love your plan with your insurance company, with your Medicare Advantage plan, and you might think, I don't want to change because I like my doctors that I go to. I like this plan. I like the customer service. Knowing that that plan may have another plan that covers your drugs even better, and being open to learning about that and switching even within that company can really help save people hundreds, if not thousands of dollars a year.
Great point.
So it's important just to keep an open mind.
It's important to keep an open mind and to check every year.
All right, great. And just to be clear, a copay is what you are paying.
Correct. Correct. So majority of the plans have copays or coinsurance. So copays, just here's this flat dollar amount. That's what you're paying. And then a coinsurance would be like a percentage of the bill. So like Part B medications, which is totally separate than Part D medications, they're generally covered at like a 20% coinsurance. So if it's $100, you would pay $20 for that.
Dr. Muzinga, you look like you want to jump in here.
Yeah, I'm just thinking about the comments that have been made, and then I know we want to talk about the changes that are coming. And so as soon as Amanda talked about prescriptions and the affordability of those medications, automatically we have to start talking about the Inflation Reduction Act, and those changes are coming over the next several years. And the first one that's top of mind is protection for members in terms of their prescription drugs. So 2 things: coinsurance, which is confusing as all get out, but basically, as I understand it, you have, once you get up to $8,000 right now, you're paying 5% coinsurance on the medication through that whole calendar year with no cap. Yep. So jumping ahead to that question, next question about the jury that we were talking about before we got together, in 2024, that it's going to be capped at that 8,000. That 5% coinsurance goes away, yes, which is good for Medicare beneficiaries. And then the second part of that is the expansion of the extra help program. Yes. Right. So right now there are 2 parts. If you qualify based on low income and you get that designation, you either get it partial or full. And if you're partial, you're still paying extra. And so if you qualify for extra help in 2024, it's automatic. It's a full coverage. Yes. And so it's going to cap that spend on the prescription
if you're qualified
drug.
actually right now. So since we're in the latter half of 2023, if you're on extra help right now, you're automatically going to qualify through 2024 for full extra help. So that's going to save a lot of folks. Extra help is an income-based program, but it's going to save a lot of folks a lot of money on their Part D drugs.
Okay, and extra help, that's a special program. I mean, we could all use extra help, but this is something specific, correct?
Yeah, it's extra help with prescription drugs. It's a very creative name from the federal government, but it does say what it is. And this is for folks with lower income, lower resources, for help with their prescription drugs. Now, those limits of income and resources are usually, I shouldn't say usually, but a lot of times the first time that seniors have ever qualified for any sort of help program. So it's really important for all of the people in your life that you're screening them for this extra help program. Again, it's based on income and resources. The number's around $1,700, I want to say, a month. Now I'm a little bit spacey because it just changed. But call us at OSHIP and we can help get people screened for the extra help program. And I believe that they're going to speak on extra help later on in the presentation as well when they talk about prescription drugs.
Oh, that's good. And of course, that's a good segue because OSHIP is where you can go to get unbiased information, correct?
Yep, absolutely. So again, we work in the Ohio Department of Insurance. We're a government program that's federally funded, and we are able to provide unbiased, objective information. So when you call our hotline, we are not going to try to sell you anything. We're going to give you all the information that you're able to make those decisions in an objective, unbiased fashion. So in addition to doing drug plan comparisons, Medicare Advantage comparisons, we can do casework. If you get a bill you're not sure that you got, we can tell you what an advertisement means. If you get a postcard and you're not sure if it's from the government or if it's from a broker or whatever. So we can answer all those questions for you relating to Medicare and sometimes Medicaid as well, in an unbiased, subjective fashion. So we're here for you.
Yeah, and that's so important because so many of the commercials and the flyers that we get in the phone calls,
Yeah.
they try to make it sound like they're from the government or that they're looking at all the plans, and
Yeah.
they're really not. They're
And
pushing something specific.
yeah, and when we were talking about changes for next year, there's going to be some great changes as far as advertising goes. So one of the big changes that's going to happen for next year is they're no longer going to be able to use that Medicare card in their advertising. So when you see those commercials that have the Medicare card on them, or you get those postcards that have the Medicare card, it's very confusing for folks because it really does make it look like that official Medicare information. So being able to make sure that consumers are able to tell the difference between an official, letter or not advertisement from the government. We don't advertise, but official correspondence. So we are going to see some what I think are some necessary Medicare advertising changes coming up.
Okay, excellent. Anyone else want to chime in?
I mean, I think so. So you have the kind of unbiased. So Medical Mutual, we work with independent agents. So I don't know. Are you guys able to enroll into plans?
We are able to enroll into Part D plans and Medicare Advantage plans,
Okay.
but not supplements.
Okay. So we work with independent agents. So there's a couple of ways that Medical Mutual could help make sure that you're getting assistance in finding the correct plan as well. So we have our internal sales team that would represent Medical Mutual. And then we also have our independent agents that not only represent Medical Mutual, but also represent other carriers to help find that unbiased opinion. So on our website, medmutual.com, I think it's /find an agent. We'll make sure that we share the link in the chat, but you can go out there and see some of the agents that we would trust, that I would send my grandma to. Because I think that that's important, because there are some out there. It's a very small amounts, but we know that there are some out there that don't necessarily do the right thing.
I know. I hate having to come places and talk about, agents, because 99.9% of them are
Yes.
doing the right thing, but we do have to talk just a little bit about Medicare fraud sometimes, because it does happen, unfortunately.
Absolutely.
So,
Yeah.
Absolutely.
What is Medicare fraud?
oh, Medicare fraud. So Medicare fraud is a $2 billion business in the United States, unfortunately. So we do see bad actors out there that are taking advantage of our most vulnerable population. Some things to look out for when we're looking for Medicare fraud are people calling and identifying themselves as Medicare. That is a huge call that we get at OSHIP. They call around 64, 65. They're able to get a call list of people turning 64, and they say they're here to help you sign up for Medicare over the phone. So just knowing that Medicare doesn't make outgoing phone calls, when you get an advertisement in the mail and if you're not sure who it's from, you can call us at OSHIP and we can help you with that. So it's really the advertising, the phone calls, and door-to-door sales. If someone's coming to your door to sell you a Medicare product uninvited, that's really, illegal, basically. So just making sure that everyone's following the rules and that you're aware when you get correspondence, when you get a phone call, who's really on the other line of that phone call.
I think you just gave me a great story idea for next year
Oh.
about Medicare fraud. That would be really interesting.
And this is why we work together to make sure we're
Absolutely.
disseminating that information and what are those resources so everyone makes the right choice. And that's our commitment to the community in the state of Ohio here at Medical Mutual. So we really appreciate that work that you do.
At the ODI, Ohio Department of Insurance, we take it really seriously. So anytime anyone gives us a call, we investigate every single phone call that we get for Medicare and, of course, for all insurance as well.
All right, great. Well, I think we're ready for some reader questions or viewer questions. Before we go on, does anyone have anything else they'd like to add? Any other points?
Ready for some user questions?
All right, okay, all right, here we go. Audience questions. I am a retired federal employee and have coverage through a federal employee health program. Does it make sense for me to sign up for Medicare if I'm able to keep my current health insurance?
I will take this one. So FEHB is such a fun question that we get a lot, especially here in the Cleveland area with NASA and so many federal agencies being here in Cleveland. FEHB can work both ways.
Okay, can I stop you there? What is FH?
Oh, sorry. Federal Employee Health Benefits. So this federal employee, so FEHB, Federal Employee Health Benefits, which is offered to both current and retired federal employees. With FEHB, some people are going to want to sign up for Medicare. They're going to want Medicare to be their primary and their FEHB to be their secondary. Some people are going to just have FEHB. And unfortunately, it depends on exactly when you started with the federal government and exactly when you retired and where you live in the state, what options are going to be available to you. So unfortunately, we really do refer people to OPM, which is basically HR for federal employees, to help make those decisions. So that's really an individual decision that OMP is going to have to help you with.
Do they talk to their employers, HR, or where do they go?
So OPM is the national HR basically for all federal employees. So that would be who they would talk to.
Okay.
Yep.
All right. Great. Great. Okay. Another question. If I'm retiring at age 65 and going on Medicare with a Medigap plan, can you retain COBRA for dental only when you leave your employer? And whoever takes this question, can you please start off by defining Medigap and COBRA?
Who remembers what COBRA stands for?
Not me. That's why I asked the question.
It's a continuation of
It's
coverage.
Consolidated. Yeah.
Yeah.
We all know what COBRA is. Basically, what COBRA is when you leave an employer, whether you are let go or whether you leave willingly, you're able to retain your health insurance that you currently have, but you pay full premium. So instead of your employer paying for some and you're paying for some, you keep the full premium. So the question here would be if you're retiring at 65 and going on Medicare, COBRA for dental only. That's a great question. My understanding for dental only is that would be up to your employer. That's my understanding with that, but I'm not 100% positive.
I would
To be
agree
completely
with
honest.
that.
Yeah.
Yeah, I would agree that it would depend on what benefits they can enroll in.
I do want to add as well, though, that COBRA, if you are over 65, is not credible coverage. So you should not retain COBRA past 65 without signing up for Medicare. You may face a penalty later on if you do that.
Correct.
Doctor, you want to?
That's a really great point. I had not even considered that. That's great.
Yeah, I
Didn't even
think
consider.
on the dental side though, like there are what we would refer to as standalone dental plans out there. So Medigap is a Medicare supplement. So when she was talking option A or option 1
Yes.
on your chart, that's the Medigap plan. So that's what supplements Medicare A and B. But there are standalone dental plans out there. So Medigaps have to they're the same with every single carrier. They're standardized. Every single F plan is an F plan with everybody, but you could still purchase a standalone dental plan and not necessarily need to loop in the COBRA.
Right.
And I'd like to say that when people have such very specific questions, they can go to OSHIP and get those answered, right? Because these are very specific
They are very
questions.
specific.
Yes.
And I'm hoping we have people on the chat that are probably answering some of these as well. So
Yeah.
Oh, good.
Yeah.
Oh, good. Okay, we'll take a few more. My wife will turn 65 in June. I will be only 64 until March of 2025. She will join Medicare in June. I think the person meant. She will join Medicare in June. I have stage 4 kidney disease, liver disease, type 2 diabetes, and Crohn's disease. Viewer, we're very sorry for your health challenges. Can I piggyback off her for 9 months until I turn 65?
So the Medicare plans are all individual plans, meaning like if you're on an employer plan, you can cover yourself, your spouse, your children, and it's all under one plan. With Medicare, each person has their own plan. So you can't have a spouse under Medicare, but there are like ACA plans. So if you were no longer eligible for a group plan,
ACA,
affordable care plans.
Okay.
So, or you might hear Obamacare. You would be able to purchase one of those on your own. So you couldn't come onto his Medicare plan, but if he was, or she, I'm sorry, he or she was still on the group plan, you could do that, or they could purchase their own individual policy.
Doctor, do you have some advice for this person with all these underlying medical conditions?
Critical. I don't know the background here, but if covered by a plan right now, don't leave it until you make a choice about the options that we just outlined, and you can't do the piggybacking on Medicare. To Amanda's point, as an individual coverage for your wife in this case.
Yeah, the only other thing I would add is I'm not, of course, wishing this on anyone, but if you are diagnosed with end-stage renal disease, you do qualify for Medicare. So again, not wishing upon that, but if your situation does change and you are diagnosed with ESRD, end-stage renal disease, you will qualify for Medicare at that time immediately.
All right, thank you. Is an EGWP plan, and we're going to need to have that defined, considered original Medicare or Medicare Advantage?
We've got somebody who knows this inside and out, and it's not me.
I go that
We're
far.
so lucky. Great.
But
We call 'em
basically,
egg
it's employer group. Yeah, we
Ah.
say egg whip.
Yeah, I've never
So
heard that
it's-
before.
It's basically employer group Medicare Advantage plan. So it's not original Medicare. Basically, your employer sets up their own Medicare Advantage plan offered to retirees, things like that. So it's a customized Medicare Advantage for a specific employer.
Yeah, it's not coming directly from the federal government
Right.
insurance
It's
plan.
still
It's-
coming from the carrier. Yes, correct.
So it's not original Medicare, but is it Medicare Advantage?
Yes, it is.
Okay, so it's
Yes.
in that category,
It's a
Medicare
group
Advantage.
Medicare Advantage plan. Yep.
Okay, terrific. And I'm advised we only have 10 more minutes, so we'll try to get in as many questions as we can. Why am I paying a premium for Medicare? I thought the Medicare portion was free at 65.
I always say that I don't answer why questions.
That-
I just answer how I can
I-
explain them. So Medicare, Part A. So as the doctor mentioned earlier, original Medicare has two parts. Part A is your hospitalization coverage. So if you've worked for 10 years or 40 quarters, or your spouse worked for 10 years or 40 quarters, you won't pay for your hospitalization coverage. The premium that you have is for Part B. So your Part B premium this year is $164.90. And that's going to cover your medical insurance. And that covers 80% of your medical insurance. So if you think about that premium covering 80% of your medical, it's very supplemented from Medicare itself. So you do have that Part B premium, but your hospitalization coverage is free.
I would just add as well that to the question of why, I don't like to answer the whys either. In thinking about the cost of healthcare over the years and the decades going up, the costs are going somewhere. And so the whole system's trying to figure out who's paying what, and the government's kicking in some, we're kicking in some as individuals. And so that I think that's part of the why. But you're right. It's really related to that Part B, because Part A, if you've worked and paid your your Medicare tax over the years, you and your spouse will be covered under A with that, no
Right.
premium there.
Yep.
That reminds me of a question we had last year, which was along the lines of, why are they taking it out of my Social Security? And I think the answer was that it's an automatic withdrawal. And I think last year our panelists said that was a good idea because then you won't forget.
Yeah,
Can you address
absolutely.
that?
Absolutely. So your Medicare premium, if you don't pay for 3 months, your Medicare is terminated and you have to restart it again, which can cause problems for a lot of people. So that automatic withdrawal of your Social Security benefit before you receive it really helps people avoid that situation. Yeah.
Okay. Another question. I understand that if you go with regular Medicare and don't get a Medigap plan at the beginning, you may not be allowed to get one later. What if you leave a Medigap plan that you had since the beginning? Will you be able to get back on during a later open enrollment period if you want?
So generally, no. So she mentioned initial enrollment period for Medigap plans. So Medigap plans, you have 6 months from the time you enroll in Part B to enroll in a Medigap. Medigap and Medicare supplements are the same thing. The terminology is interchangeable. So you have 6 months to enroll. Outside of that, unless you have some type of qualifying event like losing employer coverage or something like that, you are subject to what we call medical underwriting. So you can apply for a supplement at any time during the year. It doesn't matter. But if you're outside of that initial enrollment period or don't have a special enrollment period, you would have to be able to qualify medically. Completely different than Medicare Advantage. Medicare Advantage, during open enrollment, anybody that has Medicare A and B can move to a Medicare Advantage. We don't ask any medical questions. We used to ask end-stage renal, that's gone, but Medigaps or Medicare supplements are different. So if you think you're going to want that option, I would not recommend disenrolling from it, because you're not necessarily going to be able to get it back. Whereas an Advantage plan, you could switch all the time.
Yeah, and we often get the questions, what are those medical questions? What do they ask me? And it's important to understand that every company is allowed to set their own qualifications. So it's not a standard physical or medical survey or things like that. Every insurance company that sells Medigap or sells supplement is able to set their own regulations as far as that goes. And they can change as well.
All right, great advice. One of our viewers wants to know, does traditional Medicare or option 1 cover all doctors and hospitals?
Sarah doesn't like to answer the why questions. I don't like to answer the all or none questions. And I think the answer is no, because you have to be the provider, the doctor, the hospital has to be participating with Medicare. And you can say, I don't accept what Medicare pays and hang your shingle up.
I will add it's 98%.
Yeah,
so
it's up there.
98% are going to accept Medicare, which means they'll also accept your Medigap plan if you have one. So we can't say all, but we can say 98%.
Yeah. Well, like we said earlier, you have to make sure that the doctor is in the network of the plan that you
Right,
pick.
but not with option 1. So if you're going with the first option with the 3 cards in your wallet, like I explained earlier, that is not going to have a network of doctors and providers. Anyone that accepts Medicare is going to accept your supplemental plan.
Okay, good to know.
Yep.
How can Medicare Advantage plans have 0 premiums? They're coordinated by private insurance companies, right? How do they make money?
Yeah. So for Medicare Advantage, you're still going to pay your Part B premium. So whatever you're paying for Part B, you're going to pay that. And then the easiest way to explain it is that Medicare then pays us to administer your Medicare benefits. So it is typically easier for us from like a coordination of benefits perspective, some of the wellness initiatives that we might have. So instead of them paying out the claims, they pay us a certain amount per member per month, varies by county, medical conditions, a slew of things, to administer the benefits on their behalf.
Exactly. And the additional pressure on the private insurance company to help manage the things that you need help with.
I often say that, original Medicare at that point is no longer paying 80% of your care. So they're, like you guys mentioned, giving it to the private insurance company.
All right, let's tackle another question. Can I just accept Medicare 1 and not sign up for Part B and Part D? Is that allowed? Does anybody do that?
I'm not sure what Medicare 1 means. I'm assuming they're talking about A.
I think, are they
Maybe
talking about your
original
option?
Oh, we're talking
Maybe.
about
Option 1, I
Okay.
think.
So not sign up for Part B and Part D. No, when you sign up for Medicare, you can sign up for A only. So if you want to sign up for Part A, like Amanda mentioned earlier, if you also have work insurance or something like that, you can sign up for A if you have other primary insurance. But when you sign up for Medicare, you're really going to sign up for B and D. If you don't sign up when you're first eligible and you do not have work insurance, so if you're turning 65, you're retired, you don't have insurance, you don't sign up when you're first eligible, and you go to sign up for B and D later, you are going to face an enrollment penalty for not signing up when you're first eligible. So it is important to understand that if you are 65, you need to sign up for Medicare if you don't have current employer insurance, either for yourself or your spouse.
And we definitely want to avoid those penalties.
Absolutely.
Right. Okay, this is our last question. What are the disadvantages in moving from Medicare with a medical mutual supplement to a Medicare Advantage plan?
So I think you did a great job explaining supplement versus Medicare Advantage. So supplement, like if you want that broad network and you want to have a monthly premium and know what your budget is, then you're going to want to stay supplement. There's never necessarily a disadvantage. It's just kind of what situation you're in. Medicare Advantage, you are going to generally have a closed network of providers. So if the Medicare Advantage checks all your boxes, then I would say give it a try.
I also want to add too with that question, this is getting in the weeds just a little bit, but there is something called a trial right period. So if you have a Medigap supplemental plan and you want to try a Medicare Advantage plan, you can do that. if you switch back to your supplement within a year, you'll be able to get that supplement back. So if you've been thinking about trying a Medicare Advantage plan from option one, you do have the opportunity to use that trial right period. And then as long as you switch back within 12 months, 364 days is what I say, you can switch back to your supplement.
Doctor, did you want to join in?
The only other thing, remember we talked about some of the additional benefits that you may get with the Medicare Advantage plan. So if you're really interested in looking at those that you wouldn't get with just the supplement, that's important to take a look at as you're making your choice.
All right. Well, we've had some terrific questions from our viewers and terrific answers from our panelists. Is there anything anyone would like to add?
Just one more shout out for our hotline. Again, we're open Monday through Friday, 7:30 to 5, 1-800-686-1578.
All right. Fantastic. Well, in that case, I'm going to turn it back over to Eric, who's going to continue us on. Eric.
Thank you so much. And what a great round. Now, if you want to make sure you have all of that information in one place, we're going to have access to the event recording, a Q&A of today's session, and other helpful Medicare resources on our resource page. And the link to that page is right now in the chat. And you'll also get it via email, by the end of today. And don't forget, coming up, we have Apex Skin coming to talk about Medicare and your skin and how to get the coverage you need to protect yourself. And I also want to say a special thank you to our presenting partner, Medical Mutual. And here's a short video.
Medical Mutual has the pulse on what Medicare members really care about.
To go to somebody that you're comfortable with, a doctor that you're familiar with or that you've heard very good things about, that in itself is worth gold.
Which is why we offer access to an expansive network of doctors and hospitals, so you can enjoy the things that matter most, like the peace of mind that comes with having convenient access to quality care.
I'm Layla Corey. Medical Mutual is my Medicare Advantage.
Medicare Advantage plans from Medical Mutual, Ohio's hometown Medicare insurer.
Next up, let's talk about drug plans. What you should consider when considering a drug plan. How do you know if your drugs are covered? And what is new for 2024? To give us answers to these and many more questions, we have Katie Goff and Amanda McFarland from Medical Mutual joining us. Katie Goff is the Director of Pharmacy, Medicare, and Information Services at Medical Mutual, where she has led the Medicare pharmacy team since 2015 in preparation for the health plan's 2016 re-entry to the Medicare Advantage market. She has more than 22 years of industry experience working for health plans and the pharmacy benefit managers. Now, welcome Katie and Amanda. Friends?
And this time we're discussing what to consider when you're choosing a drug plan. And I'm here with Amanda and Katie. Katie, would you like to introduce yourself?
Oh, sure. My name's Katie Goff. I'm the Director of Medicare Pharmacy, and I do oversight of our vendor and help manage our pharmacy benefits.
Terrific. And we had Amanda in the last session, so we certainly know you. All right, we're going to get started with some questions from our viewers. First question, do I need to sign up for Medicare Part D drug coverage if I'm currently not on any meds, or can I add Part D later when I need prescriptions?
Yeah, so I would not recommend that. So if you do not have a credible drug plan, so if you're not on an employer plan and your drug plan is not credible, if you do not enroll when you're initially eligible, you will have a late enrollment penalty. And that late enrollment penalty, you're stuck with it for the rest of your life. So as long as you have a prescription drug plan, you're going to have that late enrollment penalty on there. So we would never encourage somebody to go without a prescription drug plan. There's some relatively affordable prescription drug plans out there. So my recommendation would be, if you're not worried about the coverage, find the most affordable option in your area and enroll.
Okay. I just realized we probably should have started by defining our terms. And Medicare Part D is your drug coverage, correct? It covers your prescriptions and you have to have it. Is that correct?
Correct. Or you'll have that late enrollment penalty.
Okay. All right. So now we know what we're talking about. All right. Next question is, Prescription medication can be an expensive part of healthcare. That's certainly true. What if someone needs extra help paying for their prescription drugs? And Katie, we were just talking about that extra help program. Does that cover prescription drugs?
It does, yes. It'll cover the copays. There is a reduction in copays for different levels depending upon your qualification. I think the team did a great job explaining that it is income based. One great thing that's occurring that was mentioned is that we're basically doing away with the partial subsidies. And so I highly encourage people that if they aren't or didn't qualify before, they should check to see if they qualify again for next year. But those that have and know that they're qualified will be considered and have that better coverage for next year.
Okay. And that's so important because so many people just have crippling prescription drug bills.
Yeah, I think one thing that I hear in talking to agents is a lot of people will apply for Medicaid, which we talked about. Medicaid's helping kind of on the medical side of things. So if they don't get approved for Medicaid, they just automatically assume that they're not going to get the extra help on prescriptions, and the income criteria is different. So if you've been denied Medicaid, you should still be applying for that extra help on the prescription drug side because you might qualify.
Wow, that's really good to know because someone could really miss out on that benefit.
Mm-hmm.
Exactly. And there are other options too that members could look into. So if they don't qualify for Medicaid and they don't qualify for extra help, they can seek, if they're on brand name drugs, many of the brand drug manufacturers offer what's called a patient assistance program. So you can get those drugs for little to no cost. There are qualifications that sometimes exceed even the federal poverty limit guidelines. So we highly encourage people to look into that as they're struggling with that. And there's also discount card options. They do not get run through their prescription plan, but they are available to members for cost reduction for their drugs.
All right. Excellent information. Thank you so much. I heard that Medicare is negotiating with the drug companies to get lower prices for some common drugs. When will I see those lower prices? And how can I find out if my prescriptions are part of this negotiation? Katie?
Yeah. So what's really great is through the Inflation Reduction Act, as Dr. Musina had mentioned, there's a lot of great changes coming down the pike for everybody. One of the big things that we saw this year was the reduction of cost share for insulins. For a month's supply is now $35 copay for plan covered insulins, as well as adult covered vaccines. So those are great things. As far as the negotiated drugs. So yes, Medicare is negotiating for drugs to be at a lower cost or fair market price. And those prices will not go into effect until 2026. So unfortunately, it won't be until that year. But the good news is Medicare is not stopping there. Every year, they will continue to do negotiations with drug manufacturers and additional drugs. So this year, there were 10 drugs that were included in that negotiation. Next year, I believe it's 15, and it continues to increase. And they'll continue to do so. I think it caps out at 20 every single year. So it's great news for members and Medicare beneficiaries as they're entering in the program.
So that's a slow rollout that's coming on the horizon.
That's right.
Great, great. All right, another question. What is the coverage gap or Medicare Part D donut hole? Can you define these for us?
All right. So there's a lot of numbers associated with these things, and it has been a confusing topic. It is considered a phase of the benefit. So every year, members, or at least the traditional Medicare Part D benefit, has a deductible phase, what's called an initial coverage phase, and then they have a coverage gap phase and a catastrophic phase. So it is very complex, but the donut hole originally, just as a history lesson, was back when this program started, Medicare didn't pay anything during the period of the coverage gap. So they called it the donut hole because there was coverage at the beginning and at the end, but then there was a big gap in the middle that they didn't cover. But that has slowly closed, and more has been on either plan liability or manufacturer liability. So there was a coverage gap discount program that initiated in 2010. And all of that, again, another history lesson. Fast forward to where we are moving forward in 2025, there will be big changes on the horizon there where you won't even hear of the donut hole any longer.
Okay, so Amanda, the donut hole is disappearing.
Yeah, it's been getting phased out and will eventually be gone. One thing I do want to kind of call out with the donut hole or coverage gap, not every plan necessarily has drugs that aren't covered at the standard copay. So like you might have a tier 1 or tier 2 that you're still paying zero for. So I don't want people to like panic like, oh my gosh, I'm going to have to pay for all of my drugs during that coverage gap. It really varies by plan what those copays are during the coverage gap.
Okay, good to know. How do I know if my drugs are covered under a new plan?
So how you would first want to verify is whoever you're working with, whether it be an agent or broker, they can work with you in looking up on a plan's formulary what exactly that plan covers. If you're looking at several different plan options, a broker and agent is great to work with because they can help kind of assess all of that through different online tools. Each plan, Medicare Advantage plan like ourselves, we have online search tools and engines that can help you decide which plan works best for you. A lot of them, you enter in your list of drugs that you take, and then it basically lines up what your cost will be for the year. And there is a similar tool called Medicare Plan Finder that cms.gov or medicare.gov actually has out there for members to utilize on their own.
Yeah. Well, that would be important to make sure all your drugs are covered.
Yeah, absolutely. So I think, kind of if you're looking at a prescription drug plan versus Medicare Advantage, I would definitely recommend using medicare.gov or another tool that allows you to kind of plug in your medications. If you work with an agent, they typically do that on your behalf so that you know that you're getting the correct results. But, they plug in your medications and then you can do a side-by-side comparison of the prescription drugs versus the Medicare Advantage and really determine which one is going to give you the lowest cost. But then you have to, again, look at the medical benefits that will come with that. So if you're purchasing a standalone prescription drug plan, you're going to be looking at either original Medicare only or that Medigap plan that we talked about. And then under the Medicare Advantage plan, you would have everything all in one. So it is important to kind of determine which one's going to be the best option for you.
Yeah. It occurs to me that finding out these plans, this is a lot of work.
It is.
I mean, it sounds like homework. You've got to get your list of prescription drugs. You got to know who your doctor is. There's a lot how long does it take the average person to figure out what they want to do? Do you know?
I feel like if you were just like trying to figure it out yourself forever, but we work with agents that do this all day, every day. And they can do it much quicker. They're going to have that analysis done before you meet with them to narrow it down to which plans are going to be your best options.
And going back to what Amanda had said earlier about making sure you're vetting your options every year, especially with the changes coming with the Inflation Reduction Act. There are so many different things that are going to be up and coming and changing. We define donut hole today, but it will be a thing of the past come 2025. And so we highly encourage people to really check what is in store for them each year, what is available and out there. Utilize your agents and brokers, utilize the OSHIPs and the things like that can help support you.
Yeah. So this webinar is giving people help with their homework.
Exactly.
Yes. All right. Well, let's take another question. Since I do not need to sign up for Part B because I'm covered by my spouse, I do not need to enroll in Part D until I need to enroll in Part B later. I'm going to read this again. We're getting help because we can read it, but I'm going to read this again aloud for our audience. Since I do not need to sign up for Part B, like boy, because I am covered by my spouse, I do not need to enroll in Part D, like dog, until I need to enroll in Part B, like boy, later in life. Correct?
Correct. So assuming that your spouse's employer plan is credible, and what that means is the benefits that they offer are equal to or greater than the standard Medicare model, as long as it meets within that criteria, then you would not need to enroll in a standalone prescription drug plan. Employers are required to tell you annually if that plan's credible or not. So you should know if it is not and know that you would need to elect a standalone PDP.
Yes, I was just going to say if you're a Medicare eligible and you're on a commercial plan, they have a requirement to give you a credible coverage letter telling you whether or not that prescription drug plan by the commercial payer is credible to Medicare.
Okay, what does that mean being credible? There's ones that are not credible. What does that mean?
That's right. So meaning, so Medicare basically defines being credible as equivalent to their what I had mentioned before and what Amanda just said with a defined standard Part D benefit. So every year CMS puts out in the spring what the defined Part D benefit parameters are. And it's through that typically commercial plans are required to go through an assessment that determines whether or not that commercial plan is credible to that base standard plan by Medicare.
Okay, I think you were getting in the weeds a little bit, but you can be our guide. And just to illuminate, CMS stands for Centers for Medicare and Medicaid. That's the federal agency.
That's correct.
Right. Okay, great. Another question. Does the coverage of different Part B plans vary widely?
Yes, it can. And most of them have a tier structure. Most of them typically you see tiers 1 through 5 as a benefit structure. Sometimes you see a 6-tier structure. There's also different formularies, which drugs are covered, and that can vary widely. Some plans may cover one drug over another, and the plan next door covers the one that's not covered. And so, yes, they can vary widely, which is why we encourage you to seek guidance, utilize the tools that we've talked about today, and give people like us a call.
Okay, this is such excellent information and such excellent questions. I'm told I can only take 2 more, so let's see what we've got here. Is it true that patient assistance programs offered by drug manufacturers are not available to Medicare patients?
That is not true. Actually, Medicare patients can take a patient assistance drug. Now, what happens is that drug cannot be coordinated with the Medicare Advantage plan. So that's the differentiator. And what that means is essentially because that drug manufacturer is going to offer that drug at a discounted rate or at no cost, depending upon the program, it cannot be coordinated with the Medicare coverage. So there is no coordination of benefits between the patient assistance program and Medicare or Medicare Advantage, but members can utilize patient assistance programs.
Amanda, would you like to add in?
No, I think that from that standpoint, that's definitely perfect.
All right, terrific. And our final question. I'm looking at several here. I'm trying to see which one. I'll just take the next one. What kind of co-pays are we looking at for a zero premium plan?
So again, copays vary depending upon the different plans that are out there. And with the Part D program, there's tiers. And Amanda had mentioned before when we were talking about the coverage gap that there are certain tiers that are covered all the way through all the different phases of the benefit. And a lot of the plans, $0 premium plans, offer some free coverage in tiers 1. Some offer it in tiers 1 and 2. It might be situational. You might have to go to a preferred pharmacy to get that versus maybe a standard pharmacy. But yeah, there's quite an array of options out there. But most plans do prefer generics. And usually those generics, you get that incentive benefit wise by lower cost copays.
Yeah, the one thing that I want to point out is when we're talking zero premium plans, those are going to be Medicare Advantage prescription drug plans. You will not find a standalone prescription drug plan for zero, typically. Okay, I'm being told that there's one.
And most people don't know this, but Medicare requires us, there's certain amounts that as a plan that Medicare caps some of those tiers. So a lot of those copays you'll see might mirror across different plans, and a lot of that might be coming directly from Medicare.
All right. Well, this has been a terrific segment. Viewers, thank you so much for your questions, and thank you so much for the answers. Does anyone want to add anything?
No, thank you.
Okay, terrific. Well, we're going to send it back to Eric for our next segment with Dr. McKean from Apex Skin.
Thank you, Julie, and thank you for all of those insights. And yes, let's talk to our friends at Apex Skin to not just learn about dermatological treatments that are covered under Medicare, but also providers on what to be on the lookout for as our skin ages. So joining me for this conversation, Dr. Shannon McKean, Medical Director at Apex Skin. Dr. McKean attended medical school at Lake Erie College of Osteopathic Medicine. She spent her clinical years at University Hospital Richmond Medical Center and stayed to complete a dermatological focused internship. She completed her dermatology residency at Lakeland Health, where she was appointed chief resident. She's a board certified by the American Osteopathic Board of Dermatology and gained fellowship status from the American College of Osteopathic Dermatology. And then, of course, Jeremy Zing, Vice President of Finance. Jeremy earned his executive MBA from Walsh University and started his career with Apex Skin. It's in September of last year. With well over 14 years of experience, he is skilled in binding the link between finance, senior management, and the health of the entire organization. Welcome to the two of you. And Shannon, we will, of course, start with you. As we age, we, of course, experience changes in our skin. As you can you provide an overview of common skin conditions that affect older adults? How does that aging process impact the skin? And what are some key dermatological concerns that older adults may face that younger ones may not?
Thank you so much for having us today. My name is Shannon McKean. I'm a dermatologist in our Cuyahoga Falls location and medical director at Apex. And I first want to thank you guys for having us here because I think these talks are very important and necessary so patients understand their their plans, understand what's covered, and do all of the prophylactic and screening care that they need. So what I'm going to review are some of the most common skin conditions in this patient population. This is a very, very condensed list of the things that I will see. I kind of have it separated first by at the bottom, we see rashes that are more common as our skin barrier breaks down. We're more prone to certain things like that. Up top, you can see some of the benign lesions. These are probably the most common ones that I see patients come in with. These sometimes can be difficult for patients to distinguish the benign lesions versus the category underneath of the cancerous and precancerous lesions that I have listed. And I will kind of go into a little more detail as to why it's so important to get checked and to just do your annual skin exams or your skin checks, which should be covered by your plans. Next slide, please. So this, I always find this a very interesting slide. If you can see on the right-hand side, because some people will say, I don't have anything wrong with my skin. I don't need to go in for my skin checks. And if you look on the right-hand side of the screen, you can see the woman, it doesn't really look like she has a whole lot on her skin at this time, but she's put under what's called a UV camera, which helps to see some of the UV damage that is on the skin. And if you can see in the far right-hand picture, there's a lot of those lesions that are coming up, and those are from damage in the skin over your lifetime. And those are potential precancerous and cancerous areas that we see. If you look over on the left-hand side, you can see there's a young girl, and that's already starting some of that damage at 17. Next slide. And I always put this slide up because I feel like it's very striking. 1 in 5 Americans will develop a skin cancer in their lifetime. That number, or the likelihood of developing a skin cancer, increases as time goes on, because the more UV damage you've had, the more sun exposure you've had, that increases your risk. Next slide, please. And so this is a layout of some of the three most common types of skin cancer that we see. If you look on the left, you can see the basal cell skin cancer. The middle is what's called a squamous cell skin cancer. And on the right-hand side, you can see what's called a melanoma. Some of these changes can be very, very subtle, and that's why it's so important to get your screening exams. Next slide, please. Yeah. And then here, so I always tell people to kind of check your skin, look around, see if there's anything that's new, different, changing. Honestly, if there's nothing that you're concerned with, we still recommend an annual exam once a year, and that's covered by your insurance. And again, from the slide previously, some of those changes can be so subtle. There's many times, probably half of my schedule each day is doing skin cancer screening exams, because it's so important. And there's so many times that we find something that somebody didn't know was on their skin. So I really just encourage people to know and understand their plan, and not just for dermatology, but for other things as well, and get your annuals, your screening, all of that done. Next slide. And from here, I am going to pass it over to Jeremy to go over in a little more detail what is, more of the financial and the covered benefits of it as well. Thank you.
Yeah, thanks, Dr. McKean. I apologize, my camera's a little laggy, so it makes me look a little funny on the screen, but just a couple quick things from my side. Medicare covers all of your medical dermatology care. So medically necessary items, Medicare is going to cover all of those things. What it won't cover are some things like aesthetics. If you want to get some Botox injections and make yourself look a little more pretty, those things won't be covered. And some new of the prescription drugs that are coming out now recently, those take a little bit of time to get covered by Medicare. And the other thing I'd like to point out is Medicare usually will cover 80% of your claims. And then if you have a secondary, it'll pick up to 20% after you take care of your copay or co-insurance. Thank you, Shannon.
All right, so Jeremy, I think you started to get into this, but I'm wondering, in the context of Medicare, if you two could elaborate a little bit on the types of dermatological treatments that are typically covered, the ones that people are typically coming to you with, and outside of kind of the aesthetics, the Botox, and are there any specific criteria or limitations that we should be aware of when we're trying to take care of ourselves and use Medicare at the same time?
So medical things, like if you come in for a spot that you're concerned with and you need a biopsy on the skin, we typically do that in office, and those are covered by your insurances. Again, knowing your copays and things like that is always important. So you know what your, as they referred to earlier, your out-of-pocket max is. But those all go through insurance. Biopsies, if it is a skin cancer and it needs to be treated, there's Mohs surgery, there's excision, there's what's called an ED&C. Those are all covered by insurance because those are not cosmetic things. Those are medical things that require treatment and therapy. Some of the precancerous lesions we had mentioned earlier, there's treatments for those. There's prescriptions that we can use. There's in-office procedures. Again, those are covered benefits by insurance because these are precancerous lesions that require therapy.
All right. And then what advice do you have for older adults navigating Medicare to make sure that they've got adequate treatment for any of the needs that they have, especially with kind of the skin that we're talking about right now?
I'm sorry, could you repeat the question?
Sure. Yes. What advice do you guys have for navigating Medicare to make sure that older adults ensure they have the adequate coverage, especially if they have any needs in the dermatology universe?
Yeah, just reach out to some of the people that were on the stage earlier today. They'll offer plenty of great advice on navigating those claims, and just talk to your insurance carriers. They're happy to help answer any and all of those questions.
Awesome. And we're starting to get some questions coming in. So one of the questions is, are there any out-of-pocket costs they should be aware of?
Generally speaking, it's going to be your copay or your co-insurance. Those will be most of your out-of-pockets, unless your secondary insurance doesn't cover the 80% coverage.
And Dr. McKean, I'll toss this one to you. Got a question. Traveling to Marco Island, wondering what sort of sun lotions you recommend for adults and children.
So I recommend anything that's SPF 30 and above. That's also broad spectrum. I always tell people, put it on before you go out, reapply it every couple of hours while you're out. Other things that you can do outside of sunscreen alone are hats. They have great clothing now that's called UPF or UV protective factor, and you can use that as well. So some of them are like long sleeve shirts that aren't like, you don't feel like you're wearing a long sleeve shirt. They're very airy, but they protect your skin from the sunshine as well.
Okay. So I've got a couple of these questions coming in. One of them is asking, and I'm going to butcher the name of this medication, but is Opzelura covered yet? Opzeulra.
Opzelura? Yeah.
Sure, why not? Yes, let's do that one.
It depends on the indication. It has certain indications that it's covered for at this time. There's other indications where it's not covered. And that also depends on your insurance plan. There's certain medications that are covered by insurance and certain ones that are not. And so that would just be on a case-to-case basis and what the diagnosis is, what you're using the medication for.
All right, Jeremy, this one for you. Any pre-auth that people need to be aware of in dermatology?
Generally speaking, there's not much pre-auth that you're going to need. You're going to come in, you're going to get your item looked at by Dr. McKean, and they'll let the insurance know if there's the insurance will let them know if there's any other authorizations that are needed.
I'm going to hop in on that one as well. There are certain medications that do require, like medication wise, that require prior authorizations. If you're on like a biologic medication, a specialty medication that goes through a specialty pharmacy, many times we do need to do prior authorizations for the medications. In terms of like procedures, office visits, we typically don't need to do things like that.
Okay, got a bunch of awesome questions coming in here. I am going to hit you up with this one. You showed the UV camera. My wife works in aesthetics, so I love seeing that because I think it's shocking to a lot of people. But the question is, when do you use the camera? And when I come in for an annual body check, do you do it every time, or what's the trigger that makes a UV camera part of the treatment?
So we typically, like during a skin check, we won't use a UV camera. Those UV cameras are actually more used for, I think, more educational purposes. So you can see that there's truthfully damage underneath the skin. I actually have a picture of myself with one that I usually throw in there. I was trying to not be like too wordy with my slides, but mine had a lot on it too. And I'm very good about my sun protection. I wasn't probably when I was younger and
Sure.
better. But those can be very eye-opening. It is not a, it's really not a general part of a skin examination though.
Okay. Are there any differences in coverage between preventative care and treatment for existing or pre-existing conditions?
From my knowledge, no. I might throw that to Jeremy in terms of coverage, but the preventative skin checks I've never run into an issue with in terms of chronic conditions, eczema, psoriasis, things like that. I haven't run into issues with that either. Again, I can toss that to Jeremy if he's noticed anything specific with that either.
Nothing specific, but generally your preventative care is going to be covered about one time every 366 days. So you're not going to get your skin check within 9 months of it. So generally speaking, your preventative care is going to be covered one time a year.
Okay, got a couple more in here. How does Medicare handle pathology services related to dermatological procedures? And I'll throw that to whoever wants to take it.
The pathology. So the pathology is typically a separate like cost of what I do. But I have not run into issues with that either, because we are evaluating things that, we need a diagnosis on. Jeremy may have a different viewpoint of that though, if he's run into issues with that.
I have not seen any issues. We have our own internal lab within Apex, and we don't run into many issues with those things. So generally speaking, if Dr. McKean is sending it out for an extra look, that's going to be covered by your insurance.
Awesome. One last question, then we will let you go for the evening. I'm considering participating in a dermatology-related clinical trial. How does Medicare coverage apply to that, if it does at all?
From my understanding, if you are in a clinical trial, it is outside of insurance. You would have to check with your own clinical trial. We actually have a clinical research center as well, and that does not get billed through, from my understanding, Jeremy, if I'm incorrect, please let me know. But that does not get billed through insurance. There's usually things, because these are medications that, you know, we are testing for efficacy, safety, things like that. But no, I don't think that even goes through insurance, and you're still eligible to be in something like that, even if you do have insurance, from my understanding.
Yeah,
Jeremy,
that's
anything to, okay.
Yeah, that's absolutely correct. When you're participating in a new clinical study or research, that's generally going to be covered by the company performing the research. You wouldn't necessarily submit that to your insurance or Medicare. So if you're thinking about participating, we do lots of research studies out of Apex. Those are generally covered by the person providing the study.
Awesome. Shannon, Jeremy, thank you so much for your time this afternoon. And a big thank you to all of our incredible speakers for sharing their expertise and their insights. And now we want to ensure that you have all of the tools you need to confidently choose your plan for 2024. As a reminder, our resource page is filled with in-depth information and will be available soon. We'll also be sending you that email and a recording of the event, along with the comprehensive Q&A from our experts. But before we part ways, your feedback matters to us. We want to know if today's session was valuable for you and how we can improve it in the future. So please take a moment to share your thoughts in our survey. The link is in the chat. You will also receive that in the email. And one last announcement before you go, mark your calendars for November 14th from 5 to 6:30. We are teaming up with our friends from Harvest of Ohio to present a virtual event titled Healthy Aging, Medical Cannabis for Older Adults. Everything you wanted to know, but were afraid to ask. Julie Washington will be back to expertly guide this conversation, featuring hand-selected speakers, ready to dive into topics as safety, regulation, approved conditions, obtaining a medical card, how to approach the topic with your doctor, a product overview, including what to expect when visiting a dispensary. Our lineup of speakers include medical professionals, pharmacists, and compliance officers. And this event is virtual and free, and you can find the registration link in the chat. It will also be included in the follow-up email from today's event. Once again, a heartfelt thank you from all of our sponsors who made today's event possible: Medical Mutual, the Ohio Department of Insurance, and Apex Skin. Your support made today amazing. That is a wrap, my friends. Thank you for joining us. Today's Guide to Medicare, your golden retirement event. We hope to see you again. And until then, take care. And here's to a golden future.